In phase 1, we roll from our back onto our side. Our cervical spine performs flexion, rotation, and slight lateral flexion, which is created by the sternocleidomastoid. It is innervated by the accessory nerve and cranial nerves 2 and 3. Our shoulder moves into adduction, pulling our arm across our body. The muscle responsible for this action is the pectoralis major, which is supplied by the medial and lateral pectoral nerves. At the elbow, we use elbow flexion, performed by the brachialis, which is innervated by the musculocutaneous nerve. Our hip moves into hip flexion with slight adduction, created by the iliopsoas muscle group, specifically the iliacus and the psoas major, both receiving innervation through the femoral nerve. Our knee performs knee flexion with some light internal rotation, driven by the hamstring muscles, which are bicep femoris, semitendinosus, and semimembranosus, all innervated by the sciatic nerve.
Going into phase 2, which is pushing into a sitting position, our spine creates stability and balance in this phase. It is at an extended to neutral position. Muscles involved in this are rectus abdominis and both external and internal obliques. These muscles are controlled by nerves, including the thoradorsal and axillary nerves. The next joint is the shoulder. The shoulder helps to maintain posture as it is at an extended position. Muscles involved include latissimus dorsi and posterior deltoid, followed by the thoracodorsal and axillary nerves as well. Then the elbow allows subtle adjustments. It is at an extended position with the help of the muscles like the tricep brachii and brachialis. These muscles are controlled with the radial nerve. Next, we will use flexion of the hip. This allows to maintain balance and a controlled transition with the help of the muscles iliopsoas, psoas major, sartorius, and tensor fascia latae, controlled by the femoral nerve. Lastly, the knee allows controlled speed and smoothness of the movement. This involves the bicep femoris, semimembranosus, and semitendinosus, driven by the tibial nerve.
During phase 3, the sit-to-stand setup, 5 of the main joints used to perform this movement are the cervical spine, the glenohumeral joint, the elbow, the hip, and the knee. These joints work to shift the body to set up for performing the standing movement. Moving from top to bottom, the cervical spine is neutral in this movement. The main muscles that dictate movement of the cervical spine are the semispinalis capitis, the upper trapezius, the longus colli, and the longus capitis. The nerves involved in this movement are cranial nerves 1 through 8. Next is the glenohumeral joint, which performs flexion in this movement. The main muscles that contribute to this flexion are the pectoralis major and the anterior deltoid. The nerve involved in this movement is the axillary nerve. Moving below the shoulder, we have the elbow joint, which performs slight flexion in this movement. The main muscles that perform this are the biceps brachii and the brachialis. The nerve involved in this movement is the musculocutaneous nerve. The hip joint performs deep flexion in this movement as the body prepares to stand. The muscles that perform this movement are the iliopsoas, the iliacus, the psoas major, the sartorius, and the tensor fascia lata, all moving concentrically. The nerve involved in this movement is the femoral nerve. The knee joint performs deep flexion in this movement, and the muscles that perform this are the hamstrings with eccentric movement. The nerve involved in this movement is the sciatic nerve.
During this phase, the main joints involved are the shoulder, specifically the glenohumeral joint, the elbow, hip, knee, and ankle. All of these joints work together to help the body rise smoothly from the sit-to-stand position. Starting with the upper body, extension of the shoulder, specifically the glenohumeral joint, takes place as the arms push against the chair. The movement is driven by the posterior deltoid and latissimus dorsi through concentric contractions, with the axillary nerve controlling them. At the elbow, extension occurs, straightening the arms to help push off. The triceps brachii and anconeus perform this movement, controlled by the radial nerve. Moving to the lower body, extension of the hip joint is performed by the gluteus maximus, which lifts the trunk upward. This muscle is controlled by the inferior gluteal nerve from the sacral plexus. At the same time, extension of the knee straightens the legs through concentric contractions of the quadriceps, specifically the rectus femoris, vastus lateralis, intermedius, and medialis. all driven by the femoral nerve. Finally, at the ankle, plantar flexion happens by the gastrocnemius and soleus as it helps to push the body upward, coordinated by the sciatic nerve. All of these joints and muscles work to stabilize the body as it goes to stand.